viewers, I welcome you to another episode of MedLife where you prioritize your health and your well-being. We are still in October, the pink month, creating the awareness that breast cancer is real, okay? So we've talked about breast cancer, we've had someone share her experience with breast cancer, and today we want to talk about the risk factors and then the symptoms. So how do I know that I have breast cancer? And Dr. Aku Dogbey is here to take us through the symptoms and then the risk factors that has to be breast cancer. So everything you have to know about breast cancer, she will tell us all.
Okay, so hi viewers, we're going to talk about breast cancer. We already know breast cancer is one of the leading cause of death amongst women worldwide. So it's very important for you to know the risk factors and the symptoms associated with this disease. So we're going to take a look at the risk factors. First and foremost, age will be the first point I'm going to talk about. When we talk about age, breast cancer is most likely to affect women who are more than 55 years old. Even though we happen to have breast cancer in younger women, but mostly the age bracket that is affected the more is women older than 55 years old.
Menopausal age.
Exact brackets. Secondly, we're going to make mention of the fact that a family history of breast cancer proves you to getting breast cancer makes the likelihood of you getting breast cancer very high. Obesity is also a risk factor, so you should watch your diet as a lady. You should exercise. You should try to reduce your weight if you notice that you are obese. Taking alcohol is also a risk factor, so I would advise that you reduce your alcohol intake, and if possible you should stop taking alcohol. We also have smoking as a risk factor. There are so many risk factors.
Lifestyle in general, you need to modify your lifestyle.
Exactly. So in general, watch your lifestyle, but these risk factors cannot be changed. Your age, your family history, your genes, those risk factors cannot be changed. But alcohol, smoking, obesity, these things can be changed. So work on it. Try to reduce this risk factors so that you would live healthy. So now talking about the symptoms, I'm going to group it into two.
Can I talk a bit about
Okay, sure.
For the risk factors, I'd like to make mention that we are making so much noise these days because we realize that the younger ones, or we've had young people dying from breast cancer now. You see, things are changing. You are not in normal times now. So we have young people. Last time we had a 25-year-old dying from breast cancer. That is why, though ideally it's with the menopausal people, now in this century, we have people, young people, 25 years, 26 years, dying from breast cancer. So if you have a family history, your mom died from breast cancer, your grandmother died from breast cancer, your mom had breast cancer, your auntie, please take it serious, get checked, get screened. Even if you don't know, probably somebody somewhere died in your family, you didn't know. That is why we are making so much noise that any detection will save your life. So get checked, get screened, and then save yourself. Because now it's not only about the old people, the young people are also dying. That is why we are making so much noise now. For the lifestyle, please check yourself well.
Okay, so that's a very important point she has made. Get checked. So now, get checked. How do you get checked? First and foremost, you have to know the symptoms of the disease. So talking about the symptoms of the disease, we'll talk about, I'll group it into two. Look and feel. Look and feel. So I'm going to talk about the look today. The feel has to do with self-examination, which we'll do in a later video. So look, what do you need to say? As a woman, you should be confident about your body. You should be confident about yourself. Know your body in and out.
Don't be shy.
Don't be shy. Touch your body so that if at any point in time there are any form of changes, abnormal changes in your body, you'll be able to detect it, report to a health facility, and get the necessary or adequate treatment that you need. So, to talk about the look, first and foremost, stand in the mirror naked, look at yourself, look at your breast. We are going to talk about the size. Is one bigger than the other? Is it smaller than the other? Yes. So you check that. Symmetry. Is it equal in size? Exactly. Okay. That will have to do with the size. And you look at the skin. Is there any form of redness on your skin? Is there any color change, color discoloration on the skin? Take a very close look at the skin of your breast and notice if there's any form of discoloration, redness, anything unusual. Check it. And then you are looking at the skin again. Is there any form of dimpling? We call that peau-de-range. Is there any form of dimpling? The way an orange skin looks or feels like. So you look at that. Is there anything like that on your breast?
Can you explain the dimpling in like normal time for a lay person?
Okay, so when you take an orange, you see the way the orange covering feels and looks like. That is how dimpling or podorange is. That is why it's linked up with the name orange. Yes. Okay, and then so that is for your look, and we're going to talk about the nipple. With the nipple going inside, your nipple should be pointed, it should be outward. But when you notice that your nipple is going inside, my sister, please, it's a cause for an alarm, so get checked. Secondly, too, we're going to talk about the nipple. Is there any form of nipple discharge from the breast? Any nipple, red, yellow? What's the color? Is it weird?
So have you ever breastfeeding, but you're seeing fluid coming out of it?
You need to seek help when you notice any form of nipple discharge from your breast, and then you check if there is any lump anywhere around the breast which is visible. Do you even feel any form of pain in your breast? Without even touching it, you notice that I can feel some form of pain in your breast. All these symptoms, aside the feeling and then you looking, please, these are things you should look out for when it comes to breast cancer, and you should get checked. Report to a hospital, report to a health facility.
And then the side is to, on a normal day, you realize that our breast is not equal. Okay, so every lady can testify that one breast is slightly tilted downwards than the other. But then if you see, that's why she said that know your body. You should be familiar with yourself, that if you see any change that is too much tilted downwards than the usual, then you have to seek help. And then she made mention about the size as well. I always advise that check yourself after menstruation, because due to hormonal changes, you can have your breast enlarged during menstruation. So that one can cloud your judgment if you are testing yourself for breast cancer during menstruation. Okay, so after your menstruation, 3 days, 4 days after menstruation, you can now go and stand in the mirror and have a good look at yourself and do all the things that I've asked you to do. Okay. And then the pain, you can also testify that sometimes when you're menstruating, you feel a bit of pain in your breast. You see, they are all hormones and they are normal. But then after menstruation, if you're also having these things, then you go for screening. Okay, and on that note, I want to add that Sonotech Medical and Diagnostic Center, located at Osu and Tema, are having free breast examination from now till the end of October. So rush there, get your free examination. We'll teach you how to do it at home. But then if you want a specialist or like a skilled person to do it for you, you can go there. It's free of charge. Okay, and they're also having mammogram and then ultrasound at a discount. You see, so when you go there, they'll talk to you and then help you to get yourself screened and checked. Early detection says like people are dying from breast cancer. If you watch our previous video, we had someone testify about it. So that is why we are making so much noise that get yourself checked. Examine yourself, look out for the symptoms, seek medical help if you see weird symptoms, and report. Okay, get screened and spread the news. Talk to your family members, your grandmothers, your aunties. Early detection saves lives.
Very important.
So thank you for joining us. We'll come back with how to examine it. So stay tuned and keep watching. Bye.